This is Sheriff Ozzie Knezovich with the Spokane County Sheriff's Office. Today with me I have Dr. Velázquez of the Spokane Regional Health District, and we've been doing some short videos concerning the COVID vaccine. And we're trying to educate people about what the vaccine is, why we think it's a good idea for you to get it. We both had the vaccine. And one of the questions, Frank, that I always hear is this vaccine good against the Delta variant that we're currently facing?
That's a great question, and all three vaccines are effective against the Delta variant as well as the other variants. But one of the questions that people ask, well, if I'm vaccinated, why do I have to wear a mask? And there's a good reason for that, and the reason is there's no vaccine that will protect you from catching the infection 100% of the time. That's why with the flu shot, you can still get the flu, because no vaccine is 100%. But the reason for the mask is because if you do get infected as a fully vaccinated individual, there is a probability that you could still transmit to others. So you're protecting those around you, the same way that the mask will protect you from being infected potentially from others. And then the last thing that they typically ask after the mask is, well, why do people get infected if they were vaccinated? And that's an important question. I think it's a really good question, and we all need to know why. Vaccines are not 100%. These vaccines are in the 90th percentile in terms of effectiveness, and in terms of preventing severe disease or death, mortality, which is what vaccines should really do, they're almost 100%. So no vaccine is going to protect you from potentially getting infected. If you do and you're vaccinated, more than likely you will have very mild, minimal disease, which is why you wear your mask to prevent others from getting infected.
You know, Frank, one of the things that I found interesting in research on the vaccine was Israel. About 80% of the population has been vaccinated. Yes, there are breakthrough cases, but when you take a look at the data, the graphs of their spike, they're much different than the United States, and not very many people that had the vaccine were actually dying or even being hospitalized because they had the vaccine. They may have come down with COVID, but those symptoms were much diminished. Is that one of the main reasons we're still asking people, even though you may have had COVID, to get the vaccine?
Sure, and I think Israel is a good example, but if you look at the United States right now, between 95 and 98% of the people that are ill, serious enough to be in the hospital, are not vaccinated. The people that are vaccinated typically are not ending up in the hospital, and those that do, they usually have other clinical conditions. So we're seeing a very, very similar pattern, and very importantly, we see the same pattern in mortality. A big concern that we have is initially in the pandemic, the elderly were at risk because of age and clinical conditions. Now we're seeing people in their 40s in the hospital, in the ICU, which is not something we saw before. So that tells us that the vaccines do work because those that were immunized early, like the elderly, are being protected right now, as are others, like healthcare providers, etc. So I think it's important for people to know that and not take the risk. And if you had COVID, that doesn't mean that you will be necessarily immune or immune to all the variants that are out there. The best complement to having had the disease is getting the vaccine. That's actually the most comprehensive protection you can get.
Ladies and gentlemen, I think it's really important that you do your study, get comfortable with what you are reading. I did the same. The reason I became vaccinated was I did the study, I did the research, plus I have a duty to my community to make sure that I stay healthy. So I took the vaccine for that. Plus I had a child that almost died due to COVID. This is Sheriff Ozzie Knezovich. We're going to do a few more of these. I hope that they're helping. Have a great day.